Hi, I'm Dr. Drelos. This is a lecture on terminology of the nervous system. The nervous system is the complicated body system that coordinates actions and processes sensory information by sending and receiving signals to and from the body. It is related to three specialties: neurology, psychiatry, and neurosurgery. Neurology is the medical specialty focused on the nervous system. It comes from neuro meaning nerves and logi meaning study of. Psychiatry is a medical specialty focused on mental conditions. It comes from psyche meaning soul or mind and iatria meaning healing. Neurosurgery is a surgical specialty focused on the nervous system. Neurology thus focuses on medical treatments, while neurosurgery focuses on surgical treatments. Now we'll briefly overview the anatomy of the nervous system. The central nervous system includes the brain, brainstem, and spinal cord. The brain is the center of the nervous system. The brainstem connects the brain to the spinal cord, and the spinal cord transmits nerve signals between the brain and the body. For example, by transmitting signals from the brain motor cortex to the body for movement, and transmitting signals from sensory neurons of the body to the brain for sensory processing in the brain. The peripheral nervous system includes all the nerves that are outside of the brain and spinal cord. This includes the cranial nerves, which are 12 pairs of important nerves that emerge directly from the brain. The brain includes multiple lobes. The frontal lobe performs key functions relating to consciousness, communication, attention, expressive language, planning, and movement. The parietal lobe is key for sensory perception and integration, including the sense of touch. The occipital lobe focuses on visual perception, including color, form, and motion. The temporal lobe processes auditory information and pain and encodes memory. The cerebellum is important for motor function, coordination, and balance. The brainstem includes the midbrain, pons, and medulla oblongata. This is commonly referred to as the reptilian brain and is important for sleep-wake cycles, alertness, temperature, breathing, heartbeat, blood pressure, vomiting, and sneezing. There are 12 pairs of cranial nerves. These emerge directly from the brain, but are considered part of the peripheral nervous system. The 12 cranial nerves are 1. The olfactory nerve, important for smell; 2. The optic nerve, important for vision; 3. The oculomotor nerve, important for eyelid and eyeball movement; 4. The trochlear nerve, which turns the eye downward and laterally; 5. The trigeminal nerve, important for chewing and touch and pain sensation from the face and mouth; 6. The abducens nerve, which turns the eye laterally; 7. The facial nerve, which controls most facial expressions and is involved in taste; 8. The vestibulocochlear nerve, important for hearing and balance sensation; 9. The glossopharyngeal nerve, important for taste, also senses carotid blood pressure; 10. The vagus nerve, which senses aortic blood pressure, slows the heart rate, stimulates digestive organs, and is also involved in taste; 11. The spinal accessory nerve, which is important for shrugging, turning or tilting the head, and swallowing; and 12. The hypoglossal nerve, which is key for tongue movements. Now we'll discuss Latin and Greek roots important for nervous system terminology. The root A means without, not, or no. We've seen this root several times before in previous lectures. Related to the nervous system, it is part of agnosia, which is loss of ability to recognize objects. This includes the word gnosis, meaning knowledge. Aphasia is inability to express words, form words, or understand language, and includes the root phanai, meaning speak. Apraxia is inability to perform purposeful acts such as manipulating objects, and includes the root praxis, meaning activity. Ataxia is poor muscle control that causes clumsy voluntary movements and impaired coordination, and includes the root taxis, meaning order. Aneurysma means widening or opening, and is the root of aneurysm, which is a weakening or bulge in the wall of a blood vessel. A burst aneurysm in the brain can cause severe central nervous system problems. Astr means star. An astrocyte is a star-shaped cell of the central nervous system, while an astrocytoma is a cancer of astrocytes that can occur in the central nervous system. Caud means tail. The cauda equina is a bundle of spinal nerves and spinal nerve rootlets at the end of the spinal cord. That anatomically looks kind of like a horse's tail, hence the name cauda equina. Crani means skull or head. A craniectomy is a surgical procedure that involves removing part of the skull, while a craniotomy is a surgical procedure that involves opening a hole in the skull. Dendra means branches. Dendrites are parts of a nerve cell resembling tree branches that receive communications from other cells. Encephal means brain. Encephalitis is inflammation of the brain. Encephalomalacia is softening or loss of brain tissue that can occur after a cerebral infarction, ischemia, infection, or trauma. Aesthesia means sensation or feeling. Paresthesia is a burning or prickling sensation that sometimes is described as tingling, numbness, or skin crawling, and can be related to nerve issues. Glee means glue. Glial cell is a type of cell that provides physical and chemical support to nerve cells. A glioblastoma is a grade 4 astrocytoma, which is a fast-growing and aggressive brain tumor. Gravis means serious. Myasthenia gravis is an immune disease that affects the neuromuscular junction, causing muscle weakness. This term also includes the roots my, meaning muscle, and asthenia, meaning weakness. Hydra means water or hydrogen. Hydrocephalus is buildup of fluid in the ventricles of the brain. Kinesis means motion or movement. Dyskinesia is impaired ability to execute voluntary movements. Lambonine means to take hold of. This is the root of epilepsy and status epilepticus. Epilepsy is a neurological disorder characterized by seizures, and status epilepticus is the occurrence of multiple seizures without any recovery time in between. Mening means meninges. Meningitis is inflammation of the meninges. The meninges are membrane that cover and protect the brain and spinal cord. Meningitis is often caused by an infection. Ment means mind. Mentation refers to mental activity. Narc means numbness or stupor. Narcotic is a drug that relieves pain and induces drowsiness or stupor. Neur means nerve. Peripheral neuropathy is a condition of damage to the peripheral nerves, which can cause weakness or numbness. Phone means sound or voice. Dysphonia is difficulty speaking. Plege means paralyzed. Hemiplegia is paralysis of one side of the body. Paraplegia is paralysis of the lower extremities, while quadriplegia or tetraplegia is paralysis of the arms, legs, and trunk. Radicule means nerve root. Radiculopathy is commonly referred to as a pinched nerve. It is damage to nerve roots. Sclerone means harden. Multiple sclerosis is an immune disease that causes demyelination or loss of the insulating material that goes around nerves and facilitates nerve signal transmission. Som means sleep. Insomnia is trouble falling asleep, staying asleep, or obtaining good quality sleep. Hypersomnia is a condition of excessive daytime sleepiness or excessive sleep at night. A parasomnia is a type of sleep disorder that involves unusual or undesirable events or experiences that disrupt sleep, such as sleepwalking. Syring means tuber fistula. Syringomyelia is formation of a fluid-filled cyst in the spinal cord. Thec means sheath. The thecal sac is the sheath that surrounds the spinal cord and caudate quina. Vague means vagus nerve. Vasovagal syncope is a sudden drop in heart rate and blood pressure, leading to fainting, often in reaction to stress. It's mediated by the vagus nerve. Thank you for listening to my lecture today.